new report has revealed that the UK is lagging behind other developed countries when it comes to its health services.
Yeah, the report suggests the UK is spending less on health per person, has fewer doctors and nurses per head than most of its peers, and spends less on buildings and equipment, finishing bottom out of the 19 developed countries investigated. Joining us now, the Health and Social Care Minister, Helen Whately. Very good morning to you both. Let's begin with breast cancer, because, of course, we've had the remarkable story of Sarah Ferguson, who says, thank goodness she went for that mammogram. She managed to get checked, had the follow-up on the NHS, then has had surgery at a private hospital in London after 2 weeks. But we understand that because the system of calling people for mammograms has gone from a booked appointment to an invitation to book an appointment, the numbers going has dropped. Do you think it was a mistake to change the system?
Well, just starting with the Duchess of York, and I think it's wonderful that she is speaking out and encouraging people to go for breast screening, because we know that if we pick up cancer earlier, for instance, picking up breast cancer earlier through screening, then treatment can be much more effective and the outcomes and the prospects for a recovery are really, really good. So it's wonderful that she's speaking out, and I wish her very well for her recovery. To your point about the invitation process, so one of the problems that we've had is not everybody, when invited and given an appointment for a screening appointment, comes forward. So the NHS has been trying to get that system to work better following the pandemic, and also trying to get through the numbers of people who didn't manage to have usual screening appointments during the pandemic, of course, because so much of the NHS's resources were focused on helping people recover from COVID, treating COVID, and also the difficulties of needing to distance and avoid people being exposed to COVID. Has been working really hard to get more people in for screenings following the pandemic.
Unfortunately, as a result of the change, fewer people are going in. Fewer people will be in the situation that Sarah Ferguson was in, where she went for her mammogram. Even in London alone, around 12,000 fewer women had that breast screening. They were estimated to have missed out because of this new open invitations system. 1 in 20 women who do not have a mammogram miss out because of that system. You're not increasing the numbers. Unfortunately, we are missing mammograms, and as a result, more women will get to the position where they need treatment but won't know.
So I've spoke to a number of breast cancer charities who do a fantastic job campaigning and supporting women with breast cancer about exactly this very recently. And I've spoken to NHS England about it, asking about, well, can we look again at the invitation process? The NHS explained to me their reason for doing this was because they were having people not attend for appointments and wanting to make sure that when you've got staff there to do breast screening, those slots are always used so that you can screen more people, particularly following the as I said, the needing to screen more people following the pandemic. But they are looking at this process and also looking at, and it's difficult to kind of talk about it in straightforward terms, but at the IT systems that are used to make sure that everybody gets screening and the most effective use of doing that, because we know how important it is for people to get their breast screening. And I would say to anyone who receives an invitation, please come for a screening.
But we do know that it is not working, because according to this study, only 53% of women turned up for a mammogram when issued an open invitation, compared to over 60% of women who received timed appointments. You would get more women in for this vital check, a vital check that, as we know from the Duchess of York's experience, could lead to very swift surgery, which is life-saving. Fewer women are going for mammograms.
So, as I said, the one reason why we had fewer women who received mammograms was during the pandemic. Those services couldn't happen as normal. And the NHS had a problem of trying to see more people and do more screenings, and sometimes those appointment slots weren't being used. That's why, for a period, they changed the approach, and I have asked them to look again so that we make sure that we have the best possible way.
We're well out of social distancing now. We're well out of staying away from hospitals. Is it on your agenda to switch back to timed appointments?
Actually, that is exactly a conversation that I've had very recently with NHS England and said, can we make sure that we have the best system for making sure that people do get an appointment, and particularly for reaching people who are less likely to come for their appointment, actually reaching into some communities, and we may need to make contact with different community groups to make sure that people who don't tend to come forwards do come forwards for screenings. We also announced recently an extra 10 million investment in breast cancer screening units to put them in locations like supermarket car parks where they're more convenient, so people are more likely to come forwards.
Thank you. Another reason why you aren't meeting your target to get people from their first screening appointment to then see a consultant is that we've lost 650,000 appointments because of strikes since the doctors and nurses strikes began, and there's more doctor strikes coming up. Can I just ask you, because pay is set for the NHS, for doctors and nurses, by independent pay review bodies who are there to advise on whether you need to pay more to recruit and retain people. The Treasury Minister, John Glenn, said yesterday that you were considering overruling the independent pay review bodies if they recommend too high a pay settlement, even if that's lower than the actual inflation rate. Is that true? Is it part of your plan potentially not to accept the independent pay review body recommendations on pay?
Well, I'll just pick up where you started in that, talking about the strikes, which I have found extremely disappointing, because I know how
that you find them
hard
disappointing,
the NHS
but just on the point about pay, though. Just on the point about pay.
I will come to that in give me 1 second.
Okay.
I know how hard, and we're working very hard with the NHS to reduce waiting times. Yeah. That's one of the Prime Minister's 5 priorities, to cut waiting times. And it's harder to do, clearly, when we have staff striking. We know that that means some appointments have been postponed. Yeah. To your question about the pay review bodies, the process is, as I'm sure you'll know this from your own experience, that the pay review bodies make recommendations to the government, and they take evidence from healthcare unions, from public sector unions, from staff. They look at the wider market and rates of pay. They give a recommendation to government, then government considers those recommendations, and then government responds on the pay across the public sector.
Very unusual to not take the recommendations up, though, isn't it? Very unusual.
So what I say is the government is right to look at the situation in the round. You wouldn't expect me to preempt the formal government response to those pay review bodies. There's no getting away from the context for this process, though, of course, which is the backdrop of high inflation and the need to take a very responsible approach to the government's finances.
The Prime Minister's talking this week about plans to employ more doctors and nurses, and simultaneously you're telling this programme that you may end up paying them less than inflation and less than the pay review body recommends.
That's not what I'm saying. What I was just confirming is that the process is the pay review body reports back and then government responds. And part of the reason for that is government has to look at the public sector finances in the round. One of our top priorities is to control inflation, to bring inflation down. We know that inflation is eating up the pound in people's pockets. That's a thing that is so important to bring down. And that means, for instance, that you couldn't make a commitment that would involve higher borrowing, because that wouldn't be helpful for us bringing inflation down. But you're right. What we are determined to do is to continue to increase the workforce in the National Health Service.
So one final question,
we already have more than 40,000 more doctors since 2010 and 50,000 more nurses. And later this week, we're going to be publishing our long-term plan for the healthcare for the NHS workforce,
so just one final
which is a historic thing for a government to do.
On that long-term plan, you're going to be announcing later in the week plans for more doctors and nurses. Is that going to involve additional extra money for the NHS?
So that plan, the training that we will be setting out in that plan will be funded. But the important thing about this plan is it's historic, taking a forward look, looking 15 years or so ahead on the doctors, nurses and other healthcare professionals that the NHS needs to secure the future for the NHS. So we look forward to another 75 years of the NHS, just like we're celebrating the last 75 years.
But is it new money?
More details will be set out later this week on that plan.
Right. So maybe not new money.
As I said, more details will be set out later this week. I'm not going to preempt the announcement, which will be made to Parliament later this week.
OK.
Helen, Whately, thank you very much indeed.
Thank you.